Hey everyone, I'm Dr. Briana Botsford. I'm a naturopathic doctor and a women's health expert here in Edmonton. And today we are talking about a big topic. It's also one of my favorites, nutrition during perimenopause. If you notice that your habits aren't quite cutting it anymore, you're not alone. Perimenopause is a time of transition and your nutrition needs change right along with your hormones. So we're going to dig into the top 4 nutrition priorities for women in this phase of life. First up, we're talking about protein. Estrogen helps us preserve our lean muscle. And because estrogen is on the decline during perimenopause and, of course, postmenopausally, maintaining our lean muscle becomes more difficult and more important. You want to be aiming for 20 to 30 grams of protein per meal to support your metabolism, your muscle mass, and your hormone function. So you can be thinking about things like eggs, egg whites, Greek yogurt, chicken, lentils, chickpeas, tofu, whatever type of protein works for you and your preferences and your lifestyle. I think one of the most common things that I see in my practice is that people aren't necessarily timing their protein properly, skipping breakfast or they're not doing a post-workout protein. Now, those things we really only get fancy about once someone is sure they're getting enough protein. An easy way to know if you're getting enough protein is to take your body weight in kilograms. So take your weight in pounds, divide it by 2.2 to get your weight in kilograms, and then multiply that by 1 to 1.6. So that's 1 gram of protein to 1.6 grams of protein per kilogram of body weight per day. Now, if you are more active, you're going to need more protein in your diet. So that's where the nuance comes in. Knowing your activity level and also your goals will help us determine how much protein you need, but you can ballpark with those metrics and then consult with your healthcare provider to know for sure. And then you can workshop this by looking at your labels and noticing how much protein is in the portion sizes of the things that you're consuming. Now, one of the second most important things is making sure your blood sugar stays balanced throughout the day. And our mood can change drastically during perimenopause. And so when our blood sugar isn't balanced, that can also impact our mood and our energy levels. And so if we're not sleeping well to begin with because of hot flashes or night sweats or just that fun 4 a.m. I'm awake and I don't know why situation that we talked about last week when we were talking about sleep dysfunction, we want to make sure that we are balancing our blood sugar as best as we can throughout the day. So that means that we always want to pair carbohydrates with a protein or a fat. We want to try and choose more complex carbohydrates, things like oats, quinoa, berries, vegetables, fruits, sweet potato, like these kinds of things that have a little bit of a slower burn as far as energy. We also want to avoid skipping meals because keeping our blood sugar stable requires us to eat every 3 to 4 hours. If you find that you really get a second wind after your supper, it might mean that you need a mid-afternoon snack, especially if you feel you're really dragging in the time period between lunch and supper. The third thing that I want to talk about is carbohydrate. You do not need to fear carbohydrates. Carbohydrates have gotten a bad rap for a lot of years, but carbohydrates give you energy. And especially if you're active, if you're running, if you're training, you need to make sure you're getting enough carbohydrate to give you adequate energy. So you want to think about quality as well. So we're thinking about things like the root vegetables, the oats, the quinoa, the rice, beans, fruit, vegetables, real food carbohydrates that give us energy, not necessarily ultra processed things that are going to give us a quick hit of energy and then withdrawal. So a blood sugar high followed by a blood sugar low. The fourth thing that I like to remind people of in perimenopause when it comes to their nutrition is calcium. So estrogen it plays a big role in maintaining our bone mineral density. And as our estrogen levels decline, your risk of osteoporosis does go up. So osteoporosis or osteopenia, bone loss, or a disease that's associated with bone loss. And so that's why calcium is so essential during perimenopause. You typically need around 1,000 to 1,200 milligrams of calcium per day. And Osteoporosis Canada has a really great calcium calculator that you can access for for free, and you can put in your typical dietary habits and it'll give you an idea of if you're getting enough and if you need to supplement, which of course you want to run by your healthcare provider to make sure that calcium supplements aren't interacting with any of your medications from a timing perspective. From a diet perspective, to get adequate calcium, we look at things like dairy and or fortified plant-sourced milks. We look at leafy greens like kale, broccoli, bok choy. We look at canned salmon with the bones. That's actually a really great source of calcium. And then tofu is also a really great source of calcium. Another note on soy is that soy isn't something that you need to be afraid of. Soy has phytoestrogenic properties, which means that it can help trick the body into thinking we have more estrogen around when our estrogen levels are lower. And so soy and flax have phytoestrogen components, and those can actually be really helpful during the perimenopause transition. So if you're in your 40s, your late 30s, early 40s or beyond, and your body's starting to feel a little different, you know that's not just in your head. These nutrition strategies can make a huge difference in how you're feeling. If this was helpful, make sure you pass it on to somebody who needs this information. Visit us at flowyeg.ca, book an appointment with one of our expert naturopathic doctors. And if you're interested, we have a really exciting challenge coming up for the next 50 days, June 1st, 2025 until July 20th, 2025. And you're going to get that information all in your email. You can also find it at our website, flowyeg.ca. Thank you so much for being here for our 8 weeks of menopause education series. We love to hear from you. Reply to this email and tell us what you learned.